So the first thing I wanted to ask about is today, Washoe County Health District Officer Kevin Dick mentioned that they're trying to ramp up to do 1,000 tests a day, and they said that was a requirement that the state gave them. Then Mr. Dick said it wouldn't be possible for the county to get there. They're hoping to get there. Do you have a goal in mind for each county, including Clark, in terms of the number of tests you would like to see them move towards per day?
Well, I don't have a specific number that I've asked anybody for, but clearly I need a lot more testing than we had. You saw our statistics. I mean, we're at 1,000. We've been running right at 1,000, and we went under 1,000 2 days this week, which was troublesome to me. We need to be several times that, 2.5, 3.5 times that in order to get to an adequate number. Our ratios, our percentage is still 12, 13%, positives versus tests that we give. The only way we can get, and that's not accurate because in order to get tested, you have to show one or more symptoms, so people aren't getting tested that should get tested. We need to increase that denominator in that equation in order to get a better total in terms of what the actual percentages are. So it's got to be increased considerably, and I've asked all of our front-end providers to do that, whether it's the Northern Lab, the Southern Nevada Health District, the universities that are doing it, the private providers and whatnot, to get us as many tests as they can.
Have you or your office told these health districts specific amounts you want to see them increase to, or it's just we need to get this ramped up on an exponential basis?
I didn't give a specific number. I just need it ramped up considerably is the language I've used.
Mm-hmm. Can you talk a little bit about, you're talking a lot about the need to do more testing, the necessity of doing more testing. You loosened up regulations on people who can be tested based on their symptoms earlier this week, and the requirements to enter this phase 1 for the state's reopening require I think 14-day decrease in the percentage of new cases. How are those two things being balanced out, the number of testing going up while we're still looking for the number of positive cases to go down?
Well, the positive cases aren't going to go down as we do more testing. The positive cases are going to go up because the more testing you do, the more positives you're going to get. It's just going to be at a lower percentage as you do more testing. When you've got the control group that is sick, they're on the verge of being hospitalized, and we're hospitalizing presumptive COVID cases. We just need to expand the criteria, the protocols for who's eligible. Now, what I need is a trajectory. If I can start showing that it was, for example, right now we have, just say 13% positives. As it ramps up, if we go down to 11%, and then after another week or two, we go down to 9% or 10%, and then to 8%. That's what I'm looking at in terms of the trajectory.
Governor, switching gears a little bit, it's been almost 2 weeks since the Sentencing Commission gave a recommendation that you convene the Pardons Board and continue a discussion about whether inmates should be released early. Have you, at this point, made a decision about whether that's appropriate?
I have not. I have not received a report from the Sentencing Commission. I think they meet again next week. And I spoke to Justice Hardesty, and he told me they're going to come with some recommendations, but it's my understanding that they're going to, at the next meeting, they're going to come up with some formal recommendations to give to me to decide on what the next step is going to be, and then we'll decide if we're going to call a Pardons Board to order. But as of right now, I have not received any recommendations from the Sentencing Commission.
In terms of getting the Pardons Board going, getting that meeting noticed and everything like that, do you not think it's appropriate to at least convene the board or maybe set a date for that?
Well, I don't want to set a date for it when I don't know if they're going to come with regulations next week. I need to see that they come with regulations. And if they come with recommendations that say one way or the other, yes, we think you should have a release and you should call the Pardons Board to order, that's something I'll consider. If they say, we don't think that there should be a release and you shouldn't call the Pardons Board to order, I don't want to call the Pardons Board to order. So I think you have to take it step by step. And the first step is to get those recommendations, what exactly they are. So that's what I'm waiting for, and hopefully that'll be the end of next week.
Do you have any doubts about the numbers you're getting, from the NDOC about how many people are testing positive, how many people are being screened, that kind of thing? Is there an accountability basically for validating the numbers that you're getting out of the prisons?
Well, I'm confident that the numbers that they give me when I get them are accurate. I mean, I'm not getting a daily update on NDOC, procedures, tests, and positives. I mean, it's not part of the review that I get every day as it relates to our hospitalizations and intensive cares and whatnot. It's the same way I get kind of a general view about nursing homes and convalescent care facilities as well. It's not the specificity that you're speaking to specifically with those. So we'll have to wait till they come forward.
Governor, have you put any consideration or thought towards making it any kind of requirement for people to wear facial masks or facial coverings going out in public?
Well, Raleigh, I was hopeful that I wouldn't have to make it a requirement. I mean, you can see when there's protests, they don't follow the rules that I set up for the 6-foot distance separation. I was hopeful that when we said people should wear a face covering, that they would follow through, and they do that. And here again, I want to emphasize that I'm going to guess 90% of the people, 85, 90% of the people followed these directives religiously. They really do. They don't have large gatherings. They do have distance separations. They stay in as much as they can. They don't have large gatherings, that sort of thing. You get some that just think that they're immune from this disease, or that it's a hoax, and they're going to do whatever they're going to do. I think that it's difficult for me to require somebody going into a store to have one. I think I can clearly require that the store owners and their employees all have one. And that's something that we're looking at seriously for the next time we make some directive.
So just to clarify, if you continue to see large numbers of gatherings or folks meeting who are violating these social distancing requirements and not wearing facial coverings, it's something you'll consider adding in future emergency directives?
Well, I think that we're going to have to address the part of face masks, whether or not that's mandatory. Right now, it was a request, as people put in. A lot of people are complying. The problem is we've got, like I said, the vast majority, 85, 90%, are following everything that we put out there. And they're doing it, and they're staying home, and they're making a big sacrifice. And then you get a small minority that just don't want to follow any of the rules. And they want to say, look, I'm going to do whatever I want to do. My First Amendment, you can't make me. And that sets everybody back. And then you saw, for example, in Milwaukee, my hometown, I mean, they had in-person voting, and 25, 30 cases already have been traced to that. We've had it with some of the protests that have been across the country that they've traced back when they do the tracing, that it went back to that. And it's a spread. When you put that many people congregated in a place and they don't practice social distancing and they don't have face coverings, that's what's going to happen.
So you're saying if these protests continue and you continue to see people not wearing them, that you're more likely to issue an order making that mandatory, or making that mandatory in more settings?
Well, the right to protest is extremely important to me. People have a right to protest, and I have no problem with that whatsoever. I just wish that they would follow the protocols that have been set in place. If they don't, I mean, we're going to have to make a decision in terms of whether or not we want to strengthen that. Hey, I'm all for the First Amendment. You want to put a full-page ad in the paper criticizing what I'm doing, that's fine. I wish they would have taken that money and donated it to a food bank, or bought masks and donated them to healthcare workers, but they chose not to do that. They want to put an ad in the paper, so that's their right. But when you start jeopardizing everybody else's health by not following our distancing requirements, then it becomes more problematic.
Mm-hmm. On a slightly different tack, there's been a lot of national news stories about governors in other states who are Democrats, Michigan, for example, who have said that the federal government isn't giving them the supplies or things that they need due to partisan bias, or because they're Democrats and President Trump is a Republican. Do you, in your conversations with the vice president that you have on a daily or regular basis, do you feel like you would be getting more support from the federal government if you had an R instead of a D next to your name?
Well, I have a D after my name, we know. I don't know if that's what it's based on. I think, we're, I guess I get a double whammy that way because I'm a small state. And, when you do these governor's calls, you push a number, you got to get called on. And, we're not as big as, when you're calling on Michigan and Pennsylvania and Massachusetts and New York and California and Texas and Florida. By the time you get down to states our size, you're 2 hours into the call. So we don't get that much attention. But I'm not afraid to pick up the phone and call back east directly and say, hey, look, I need help with this area, that area. That's more effective for me. But I can tell you we have asked repeatedly for material goods, whether they're PPEs whether they're testing kit components. And, you know, we haven't gotten as many as I'd like. Now, have we gotten some things, some components? Yes. But have we gotten everything we asked for? Certainly not. And in fairness, when I'm on these calls, every single governor is asking for the same thing. It used to be everybody's asking for ventilators. Now everybody's asking for swabs and reagents and, you know, and testing kits and PPE. So it kind of goes in circles in terms of what we're asking for, but we'll keep asking, and I'll keep pushing as hard as I can for our citizens.
Do you attribute that more to us being a smaller state in terms of population, or any sort of partisan lean on behalf of the federal government and how it's allocating supplies?
Well, when I talked to Dr. Fauci or Dr. Birx, that's clearly not partisan. And I don't think that it's size with them either. I just think that some of them, size has a lot more to it. I mean, when you're a New York or you're California or you're a hot spot, Louisiana, you know, they get more attention. I don't want to be a hot spot. I don't want to get attention that way. I would just like to get, it's similar to a lot of other governors are making the same claim, whether it's from New Mexico or Colorado. Colorado's a little bigger, or Montana, you know, that we're just not high up on the pecking order, and, you know, there's 50 states, so it's difficult.
Governor, many people were really excited to hear about that new expansion of the call center, 100 more people dealing with unemployment claims. We're 10 or 11 days into that being up and running, you know, but we have heard people say that it's not what they need because those folks can't deal with the specific matters that are hanging up their claims. At this point, do you think that investment was worthwhile?
Well, I certainly hope it proves to be worthwhile when we're done with that, with the training. There's a lot of training that goes involved there, and now we're getting the new money coming out for the independent contractors that they're going to be involved in that, the distribution of that money. And I fully understand, Michelle, I hear this all the time from the people that are complaining that they can't get through, they can't get through. We do get calls from people that did get through. Understand, we've had 400,000 people did get through, you know, and they did file claims, and they are getting a check every single week. And nobody's telling those stories about people that did get their checks and are at least being able to buy groceries and take care of their families. People are focusing on the ones that didn't get through. I understand that those are a problem. But, you know, what I'm being told from their call centers, oftentimes those are disputed claims where the person might have left the employment 6 months ago, and now they're coming and saying, I want employment. They're being challenged from the employer side, where the reason for the termination, or that they can't provide payroll stubs or those sort of things, or there's not a matchup on the name. You know, they're using a hyphenated name, and it's not matching to what it was paid under. And those take, what I'm being told, an enormous amount of time for the customer service person to work through. It's very detailed, as opposed to one where everything falls in place. You can do it online next, and you just one after another. And that's what's causing this delay here. But we will continue working with them one at a time to try to get through them all.
Is there any way that you can transition these Alorica employees and give them access to the tools that they need to help these claims get solved? Or do you have plans to increase the capacity of state employees who are UI claims processors?
Yeah, we've talked about that in proceeding with the unemployment with that group, the private group that we've held. Part of what I'm being told is a lot of the information is very specific, it's statutory, and there's regulations that it deals with, and these folks that we've hired on the private side are not familiar with what those regulations and rules are. But we will continue to pursue increasing capacity, whether that's for more people, extended hours, till we get a handle on all these claims.
There's going to be a protest tomorrow in Reno from a socialist group. They're asking for something more than a rent moratorium. They want a rent forgiveness. Is that within the realm of possibility for you?
A rent forgiveness?
Basically, the debt that accumulated during this moratorium would be forgiven. Well,
I would tend to think, and I'm not a lawyer, I would tend to think, and I consult with my legal folks, that would be a taking. And I don't know if I could even, I don't know if I'm authorized to do that, or if the legislature would even be authorized to do that. But this is the first I've heard of that, so I don't know much about it.
Have you put in more thought to what happens at the end of that rent moratorium, and what actions you might be able to take as governor that would prevent kind of maybe some chaos ensuing with evictions and people just being unable to pay?
Well, I'm hopeful that people will be able to come up with a payment plan. That's how we set it up. They'll be able to come up with a payment plan that they'll be able to pay it over a period of time and months so that they can become whole. You know, the landlord can become whole and people can keep their place. I think I made it clear at the beginning that this is not free rent. This is just, you know, an opportunity to not pay it right now and have to pay it further on down the line. I'm hopeful that when we get to the end of this, and hopefully that will be soon, that the landlords and the tenants will work together and be responsible and come up with something that's fair on their contractual arrangement.
And then what do you say to folks that are, you know, after your, what day was it, Tuesday press conference, that are just frustrated that there wasn't any sort of measurement of how long this is going to last, whether that be weeks or months, no time frame whatsoever. Have you thought about that more in the past few days, and how do you respond to folks like that?
Michelle, I think about this every day. There's nothing else on my mind right now than COVID-19. I mean, my life has just become all consumed. I mean, it's 24 hours a day, 7 days a week. I am providing as much information as I have. When I have more, I'm happy to provide it. I mean, when I say it's black, I get criticized. I say it's white, I get criticized. I say it's gray, I get criticized. You can't make everybody happy. I've been totally honest and totally upfront. I know that people want more specificity and they want more certainty. I do too. But when I don't know, when I see the positive cases percentage going down, and then I see a tick go back up for a couple of days because people aren't practicing social distancing, or another hotspot occurs or cluster occurs, that's a problem. And then I can't say that we're on our way out of this. I am very concerned that the biggest issues to me are hospitalizations, intensive care hospitalizations, and like ventilator usage. And ventilator usage, you know, we're in great shape on that. We've got more capacity, but when I see the surge capacity is no longer there for hospitalizations, that becomes problematic to me. And if it's a positive case and they're self-isolated at home, that's nowhere near as severe as if it's a more severe case in intensive care and they got to be put on a ventilator for 2 weeks. You know, those are, and we track how those go every single day. And I need to see that start to make a turn downwards, and a consistent turn downwards. And that's what I'm hoping will come along. I will give that information as soon as possible, but the concern we've got is when you ask people to wear a mask or wear a face covering, they don't want to do it. And Riley, your colleague there, said to me, well, you're going to force them to do it. I'm hopeful I don't have to keep forcing people, that they'll do it because it's the right thing to do. And, you know, if you start loosening up restrictions a little bit, it's important that people know that if they don't follow the protocols, we're going to have to tighten them back up again, and then they'll be critical of us tightening it back up. And I don't want to save 2 weeks on the front end here for people to say, look, the governor let us off the hook and he opened up this business and that business, and I'm happier for 2 or 3 days while it's that way. And then 3 weeks later, I get this massive spike again. Then I have to say, okay, let's shut it all back down, and we undid all of the good that we've done for the last 6 weeks. So many people have sacrificed so much. I hear from these folks on an everyday basis. And, you know, and they tell me, you know, that they're getting cabin fever, spring fever, it's nice outside. Can we cut them some slack? And I want so desperately to do that. But I tell you what, if you talk to some of these patients, some of these individuals who've lost a family member to COVID, and I've said this before, who couldn't get in to say their farewell to their grandfather or their grandmother or their parents because there's no visitors allowed in these rooms. Or you talk to the veteran who's 30 days in a coma and is now able to live because we had restrictions in place. And you see the other side of the equation, then you start saying to yourself, you know, I don't want anybody else to lose any more loved ones. I mean, the culinary lost 11 people. 11 of our citizens that work on the front lines on the Las Vegas Strip or in a casino or in a business are dead because of COVID-19. I don't want to have 22 next week. I just don't want to do that. And if I can do something to keep that minimized, I'm going to do that. And if everybody would just do their part, and I'm so proud of the community that's done its part, it's just frustrating when some don't do their part and they don't follow regulations. And we're going to try to walk that tightrope and do that balancing act.
For the folks that are keeping track at home and watching these graphs and see that one day we had 24 new cases, Is it that simple, or are you looking at something like a multi-day average to see whether
it's not that simple as looking at the 24 days, because there is an inconsistency, frankly, in reporting that we're getting. You see that. I mean, I see your numbers come out. I'm a avid reader of the Independent, of the Indy. I read it every morning, and I get the updates all day long, and I follow you on Twitter, and I get all these things going, and somebody reports one thing, and an hour later, there's 5 more cases, and then 2 hours later, there's 1 more death, and it's just, they're coming in at different times, and it's constantly evolving. So I'm looking at the overall percentage, not specific numbers, and it's done on a graph basis. We've at least, after a great deal of time, clarified the fatalities so that they are really specific to the date now, and it took a long time to get that. You saw that before when we had these massive spikes because they were getting reported in batches. The same is true with some of the testing and the positives, and we're trying to work our way through that. The issue is that we're doing such a minimal amount of it that if 50 get saved and move to the next day, it makes a big, big difference. And we need to get more testing and more timely recording. And I look at the overall trend, not an individual day total.
So you're averaging out several days at a time.
I am.
Governor, going back to the prisoners one more time, I just wanted to ask, you know, we haven't had, thankfully, at this point, no prisoners have tested positive for this. But we saw in the Clark County Detention Center that immediately when we started getting positives, there was quick action to really depopulate that jail. Is there any plan sort of waiting in the wings should we start to see inmates test positive?
Well, there's certainly going to be quick action taken if, in fact, that happens. And we have the ability, and I talked to the sheriff. He called me before, Sheriff Lombardo, who's a good friend. You know, we did a lot together when I was on the county commission, and said he was going to get a depop order and have to set some folks out. And he's in a little different position than the correction facilities, where we do have an area where we can isolate if that's a thing that we have to do. We have a little bit better area of treatment. The jail is detention center. I can attest to the fact, having been on commission for 10 years, is there's sardines in there. I mean, they're really crowded in, so he had no choice but to do depop. We're not quite in that situation in our correction facilities, and you know, you do a tough balancing act, Michelle, and I've thought about this, and I've talked to the directors, and I've talked to some of the folks on the sentencing commission. You get a lot of folks that are really advocating, like, just, you got to cut them loose and release them and let them go. They don't have a place to go live. Some of them don't have any health care. They don't have any job opportunities. They don't have food security when they get out. How do you address those issues? Are they better off where they're getting at least an opportunity? At least, you know, they've got a place to sleep. They've got a place to get food, and they're getting health care, as opposed to when you take, there's not an easy way to go get a job right now. I mean, we've got highest unemployment ever. So those are things I have to consider as well. And it's tough to balance that. It's really tough to balance that. I don't want to put anybody in harm's way, certainly. So if we can make it safer, that's what we're going to do. And in the meantime, you have to think about, if they are released, where are they going to go? And that's something I think about.
And the families that say, hey, we have a place for this particular inmate, you know, case by case.
Some of them
I'm sure they're reaching out to you.
Some of them say that, and others with the inmate, they don't have a family that say they can put them there. That family's not going to say they're going to provide health care coverage for them. The family's going to say that's that same family that's at the food bank trying to get food, and they can't get enough food to feed the family they've got now. And if they put another person or two in that situation, those are real, that's the reality of it. What you're talking about sounds great, but we have to deal with reality, and I'm trying to do it, and I'm trying to balance it all in a responsible way.
And you're going to wait till the Sentencing Commission gets you some more definition?
They've given me no definition thus far. I've got no recommendation from the Sentencing Commission. You know, I read what you wrote from the Sentencing Commission and what comments of some of those people were, but those are just what the ones that you interviewed. I haven't spoken to all the people on that commission, and I'd like to know what their recommendations are, because they're there for a reason, and I put a lot of weight behind what they recommend, and I'm waiting to see what that is, and hopefully that'll come next week. Okay?
Great. Thank you so much, Governor, for your time. We really appreciate it.
No problem. Thanks, Michelle. Thanks, Riley.
Have a great weekend.